month out, and maybe you've tried different things and they never quite do what you need them to do. Well, I'd like you to take a listen to this, because this is something that has numerical results, and I'm a numbers person, so I like to see real results, and it's something that you can actually even use and sleep in. You can use it 24 hours a day. It's called Quell. It's from the minds of MIT and Harvard. It's a wearable pain relief technology system that is a feature price of $249. We actually have it on 6 easy payments, and we have a 60-day love it or return it policy. I'll get into more kind of details about the numbers, but I want to welcome in and introduce you to a gentleman by the name of Dr. Mark. Nice to see you.
Nice to see you too.
Now, you're a chiropractor, right?
Yes, ma'am.
But you're actually somebody who travels the nation helping people manage pain.
Right. Yeah, I get hired by professional athletes, musicians, to go out on the road and help them with the pain they're having from repetitive overuse or improper use, or just that chronic pain that's interfering with their lives. And that's transitioned into the everyday patient as well. So I help those who are the non-professionals and non-musicians as well.
Right, and we are talking about chronic pain. Let me show you exactly what you get, or you want to walk us through exactly what we're getting?
Sure.
When we place our order, and it's $41.50 on your credit card, and that's 6 months to pay for it.
Sure. So you get the actual Quell unit. You get it's rechargeable.
Sure.
You get a carrying case. You get the actual, it's a neoprene sleeve that this goes into, and then you get a 2-month supply of, these are called
I'm sticking
electrodes.
Yeah.
And so they're there, they're sticky there to help kind of keep onto your leg. So it's a wearable electronic device that's FDA cleared. So to me, that's really important in my practice, because I want to have something that I feel has been reviewed, is going to be safe for my patients to be able to use, and it's going to be something that I don't have to be concerned that is it going to interfere with the medication that they might be taking.
Right.
This is something that is 100% drug-free, and that's crucial.
Yeah, 100% drug-free, and you wear it in a specific part of your body, but it actually is for, let's just kind of top line it. Is this for pain in my back?
Yes.
Is it for pain in my shoulder?
Yes.
Is it for pain in my lower back?
Yes.
Is it for pain in my other lower back side?
Yes,
Is it for pain in my legs?
Yes, it is.
My upper legs and lower legs?
Pain anywhere in the body, because what happens is, what do those all share?
What do they share?
The central nervous system. So you can see in the animation here, by creating a high frequency signal behind the upper calf area, it actually stimulates into the central nervous system that allows the body's natural pain blockers to do their job and to help pain, like you said, anywhere in the body: shoulder, neck, back, leg. And this is the kind of pain that's been chronic. This is the stuff that's been interfering with your life and taking away a lot of the things that you enjoy in life.
Yeah, you know what I mean? Like, if you, for some reason, you're in so much pain you've canceled things, I think we're going to walk over here to Kim, and I'll get on the other side.
Okay.
Like, if you've just said, you know what, I don't want to go, I don't feel that well, and I've asked my mom to go places, or, you know, she's not able to go as far as she'd like to because she had surgery on a leg, and it sometimes bothers her. I said to Dr. Mark that I was looking for something like this because I want to turn her no, or I don't feel that well, into a yes. And if it's stopping you, or if it's turning things that you used to enjoy into a burden and a chore, that's too much pain. You know, and frankly, I read the reviews on this, Dr. Mark, and people were like, first of all, it's really working, but second of all, they were like, how do I know it's really working? Because when I took it off and the pain returned, I was like, that lets me know this is working.
The light bulb went off, and
Yeah.
this isn't going to help you immediately. So this isn't like you pulled your back out that morning and you're going to put the device on and it's going to work right away. This is something that's long-term pain, about 1 to 2 months in time, that's interfering with your life. And this is that nagging, aching pain that might not let you fall asleep at night. This is something that's turning cooking from a pleasure into a chore. And just with something as simple as pressing a button, and we can see down here in the actual unit. So right around here in the body, there's a little cluster of nerves that are sensory nerves. And by pressing this button, it creates a high frequency signal that travels up the leg, up into the back, like you saw in the animation. And as you saw in there, it creates it stimulates the natural pain blocker. So as it travels up in that nervous system, and the body returns or creates that pain blocker, if it's coming from the shoulder, it's going to help that.
That's going to quiet it.
If it's coming from the neck area, it's going to help with that. If it comes from the low back or the other leg, it's all shared with that one central thing, and that's the nervous system.
Let's talk about the results, because as I said, I'm a numbers person, so if I'm going to make this an investment, and we understand that this is an investment, but it's also an investment in regaining joy in your life and regaining kind of that smile as opposed to that crabbiness or that just kind of, wow, everything's a chore, it's all I can do just to make it throughness.
Right.
Look at these results.
Well, and so there's two that we really liked, and I personally, as a doctor, I'm always looking for data. Give me some real numbers that I can chew on. And the first one there is 86% were satisfied with the management of their pain. And that's a step in the right direction.
Sure.
But the real home run here is the 81% reported improvement in their chronic pain after 60 days of using this.
Yeah.
So what does that mean? That 81% could be they can enjoy walking their dogs at night again, or you can go and play with the grandkids at night. And the results or the stories that I hear from patients is really neat. And my aunt has used this. I've personally used this, and it's the kind of results that I can really get behind because it does help really affect their lives.
You know, this is where I say I love working at QVC because this is a just try it. You know, I know when I'm in pain, I'm no good to anybody. Like, I almost want to just go and be a hermit because I'm not nice. You know, I don't have patience. I'm in pain, and so I just have a short temper and all that, right? So as we're looking at here, it says smartphone. You can use it with a smartphone app or not.
Yes.
It is not needed to operate the device, but what I was going to share with you is that working at QVC means you get to try this because we have a 60-day love it or return it policy. And I don't care if you've tried everything. If you haven't tried this yet and you're still in pain, you have nothing to lose. You get this home. You can wear it as much as, can I wear it 24 hours a day, Dr. Mark?
You can wear it 24 hours a day.
And that's what a lot of people were addressing, that sleeping. That the fact that this actually helped when they were sleeping changed their lives.
Well, and there's two, and to that point, there's two really neat things with this. Is so the first time you get it out of the box, it's fully charged, ready to go. You put it on, and you calibrate it to you. So this is no longer a one size fits all. This is no longer, you read the label on the back of the aspirin, and it says, you take 2, I take 2. The first time you put this in, there's a little button that sits right back here, and you calibrate it specifically to you. And the sensation should feel like a little bit of a tingling, and as soon as you feel that tingle, you press the button and it learns from you.
Okay.
So no longer is it gonna be, well, you really don't want it to be uncomfortable.
Right.
If it's uncomfortable, it's too high. But once it learns you, then the unit does all the thinking for you. You just press the button and you're ready to go throughout your day.
And it disperses the nerve stimulus that it actually needs to for your particular need.
Exactly.
That's why, so it's customized. You have 60 days to love it or return it. It has a retail value of $298, so a good $48 more than our actual price. We're at $249, and actually $41.50 gives you the opportunity to try it. So here's where I say, as I mentioned, I love working at QVC because we give you the opportunity to try something. And if this gets to your house and 2 weeks from now you're waking up and you're going, wow, I didn't think about that ache in my neck. Or wow, I didn't think about that ache in my back or my legs or what have you. I'd say that's a home run, Dr. Mark.
Absolutely. Now, how is this? So you mentioned your mom, and she's having some issues.
She is.
What is she missing out on because of this?
Exactly. She's like, I'm not able to go into the city. She lives in the Bay Area. I'm not able to go to San Francisco and do the volunteer work and work with the folks that I want to work with, or I can't stay as long. And, you know, we only have a few hundred of these to go around. So when we're going into the summer months, when you want to say yes, you want to say yes to everything that you're doing. You don't want to say no if your grandkids ask you to go to the amusement park or the museum or to go to a play with them or to watch their ball team. I mean, if you're missing out on those, you know, those everyday but beloved events that your family is having, then you're missing out on life. I want to show you, and Dr. Mark, will you show us exactly what we're getting? Because normally, by the way, I think you only get one set of gel pads, and here we're actually giving you 2 sets.
Yeah, we're getting extras, so we're getting that 2-month supply.
Yeah.
So that's going to give us enough time to actually let the unit do its work. Again, so this isn't immediate. This is something that's going to take some time to build up. So I always tell my patients, be patient.
Be patient.
Right? You're a patient, be patient.
Yes.
And so with the unit itself, it comes with the charger, so there's no batteries needed. It's going to come with the plug-in, and it charges up in about 3 hours for a full charge, so it's really quick. You get the actual device. This is the one that's doing all the thinking. Again, smart guys behind this, Harvard and MIT.
Exactly.
Way smarter than me. You get the actual device, the actual neoprene sleeve, and on the back you can just see that it opens up. It's just a little bit of Velcro that comes onto the back. And then you get a carrying case. So it's so small and compact, you can just throw this in your purse, you can throw this on the bag. So when you're going on vacation, you're going on a road trip, just throw it in your bag and you're good to go.
So let me share with you, this is exactly what it does. Here are the results of what it happens when you actually turn on the system.
Right, so with the press of a button, all it does is it creates that high frequency signal right with those cluster of nerves right behind the calf or the upper leg. And that creates that signal that goes up into the central nervous system, creating a stimuli to let the body's natural pain blockers turn on, and to be able to affect, again, pain anywhere throughout the body. We're talking physical pain. This isn't for headaches or migraines.
Okay.
This is for maybe a pain in your neck or a pain in your shoulder, pain in the back.
And this is FDA cleared, and look at these results. This is FDA cleared, and it happens to be that nerve stimulation that produces these results.
Right, and it's the 86% were satisfied with their results, and 81% of the people actually saw an improvement in their chronic pain.
We are getting very limited, Dr. Mark, and it makes perfect sense, because if you said, I have chronic pain, and raised your hand of any kind, not migraines, 4150 gives you an opportunity to try it. Have confidence that you've got 60 days to love it or return it. Have confidence that you are going to be part of that set of people who are getting results, and have confidence that you've got nothing to lose except for enjoying your life when this works, when you get it home. V337772 is your item number. We are going to go to QVC.com because we want to share with you. Thanks, Dr. Mark.
Yeah, thank you.
We really are limited, very much so, in the Quell Wearable pain